Good afternoon. My name is Dr. Hamisi Kote, and I'm the host for Doctor's Chats. And today we are privileged to host one of the lead researchers and pioneer of fascial research in medicine. I'll let her introduce herself and she'll tell us a little bit herself. Professor Carla Stecco, welcome to Doctor's Chats.
Thank you.
Maybe we start by an introduction, your name and a little about yourself.
Okay, good morning. I'm Carla Stecco and I'm a professor of anatomy here in Padova. Padova is a very old city in the north of Italy, and the University of Padova is one of the oldest in the world. I'm also orthopedic surgeon and I follow a particular manual technique that is called the fascial manipulation, and I'm a teacher of fascial manipulation.
As you said, you're an orthopedic surgeon, and one would have expected you to take more time on the lucrative road to orthopedic surgery. But you decided to take a less popular method in fascia. What drove your interest?
I decided to become a medical doctor and then orthopedic surgeon because at the beginning I was not very convinced about fascia, and I wanted to know better the traditional medicine. But when I have seen how to manage a patient with pain, with any pain, with lower pain in a traditional way or with fascial manipulation, I have understood that I can have a faster and better result with the manual technique. And so I was curious to understand better why a manual technique can work better respect to a traditional medicine. And it was for this reason that I moved into the fascial world, and I started to study the fascia at the beginning from an anatomical point of view, a macroscopic point of view, then from an histological point of view, and now we are moving also in a more molecular aspect of the fascia.
Maybe before we move on, you just, in very brief, tell us what is fascia and why does it matter?
In the past, the fascia was considered just the envelope of the muscle, the white layer that we can see also when we eat a steak. But now we know that the fascia have a very complex and precise anatomy. As we have seen this week during this winter school, we have a different type of fascia. Each fascia has its specific behavior, and also from an histological point of view they are very different. So it's another organ that we have missed for a long time. We know also now that the fascia can play a role in pain, in the proprioception, in the motor coordination. So I think that has the same importance like a muscle, the bone, the tendon, but we have a miss.
And so, why would you say that fascia is not popular anymore in medicine with all the advancement that we've had in medicine? But how did you miss it?
I don't know why it was missed, but because in 18th and 19th century we have a very nice description of the fascia in the first test tube, in the Pature, in other book. Also at the beginning in the Fascia Anatomy we have a nice description. Then all the part about fascia were cut off. And in the new anatomical textbook there is a very small part about fascia and not precise. So probably without understanding the function of the fascia, the people started to not be interested also in the anatomy of the fascia. And day by day we create a loop. There is not an anatomical description, so nobody cares about that, and then nobody think about the function of the fascia. Now we have discovered the fascia, we have understood that the fascia have a function, and so we have started again to study the fascia, also from an anatomical point of view.
You have published the first atlas of human fascia system. What is the the message that you're trying to pass to the medical community, especially maybe minor practitioners, other doctors, and also surgeons who perform operations?
That the fascia exists, first of all,
Right.
because many people don't care at all about the fascia. And but knowing the fascial anatomy, the fascial layer can really help the surgeon to perform a more precise surgery without bleeding, with more respectful for the tissue, but also for the manual practitioner and for the people that work in the training for the people. It's important to know that the fascia have a very precise anatomy and connecting in a precise way muscle, bone, capsule, tendon, ligament, and only if we know the anatomy we can understand how we can affect the fascia in a proper way. I think that to train the fascia or to treat the fascia, we have to understand that the fascia of the trunk are different in respect of the fascia of the limb, and that they work in a different way. And only that way we can really understand what is the best way to change our fascial tissue.
Your father, yourself, and your brother have been very involved in developing a method called fascial manipulation for treatment of both skeletal pain and internal dysfunction. Maybe tell us, what is fascial manipulation?
Fascial manipulation is a manual treatment that focuses into the fascia. I think that the genial idea of my father was to create the biomechanical model of the fascia that permit us to understand what are the points and how to combine the point to balance in a very fast way the patient. So we, thanks to fascial manipulation, we have a rapid way to assess all the fascia of the patient and to treat in a very fast way.
Who can be treated with fascial manipulation? Is there an age limit? Can you treat children? Can you treat elderly with it?
We have a patient newborn until very, very old people. It's not a matter of the age, because in the past we were convinced that the children have no densification. Now we know that we can find alteration in the fascia also in the newborn, and some problem in the newborn could be related to a fascial alteration. So surely we have to check and to demonstrate better the fascial alteration, but from in my clinical practice I can really find a fascial alteration in old age, and I have colleagues that have applied fascial manipulation in very old people, and with a constant treatment they can have a much better life, because they have a better posture, they have more, they are less tired, they can work, they move better, also in the daily activity. So I think that also in the old people, fascial manipulation have a very big importance.
What conditions can benefit from fascial manipulation, fascia treatment, and why is that fascia therapists sometimes treat far away from the area of pain of patients?
That is one of the key elements of any fascial treatment. We have to move far away from the region where the people feel pain. And as you have seen during this week, the fascia connect different organs, different muscle, connect the viscera with the muscle. And we need to understand this network in our body to understand the pain and the symptoms of our patient. The nice thing of fascia is that we can often improve many different symptoms just in one section, because if the fascia connect different elements, we can improve some internal dysfunction, for example, reflux, and together with a low back pain, and together maybe with an outcome of ankle sprain. And that is amazing.
Wow, that's really interesting. One of the biggest problems, or rather one of the biggest causes of disability in the world today is low back pain. We have seen from some of your research work that fascial manipulation has greater results compared to use of drugs or surgery. Would you maybe enlighten us on why is this?
I'm happy because in the last year, were published many papers about the role of thoracolumbar fascia in low back pain. We know that the thoracolumbar fascia can perceive pain, that a chronic low back pain changes the gliding inside the thoracolumbar fascia. We have an increase of the nerve element that can perceive the pain in the chronic inflammation. So many alterations in the thoracolumbar fascia. But we know also that the thoracolumbar fascia is in a key place that can feel the tension coming from the inferior limb through the connection of the gluteus maximus, that comes from the upper limb through the insertion of the latissimus dorsi, from the front, thanks to the connection with the abdominal muscle. So many problems in the back can come from far from the origin. And thanks to fascial manipulation, we can assess the patient and to understand what could be the key element that keep the thoracolumbar fascia in the bronch tension in an unbalanced condition, and consequently fascial manipulation can give a very fast result.
A lot of back problems are diagnosed using MRI, X-ray, and we see these conditions with the arthritic changes in the back, and those are normally accused to be the cause of back pain. What's your take on it?
I think that the disc herniation, the arthritis, are just the anatomical evidence that the spine is working in the bad way. So I think that our work is to restore the correct movement of the spine and the correct balance of all the muscles that work in the spine, and obviously the correct balance of the fascia that work in that region. And then if you can do that, the disc herniation is not a matter.
Wow, that's a big one. We have practitioners watching this show, and other medical practitioners who would be interested to know more about fascial manipulation. So, who qualifies to train in fascial manipulation?
I'm sorry, I don't understand.
I'm saying there are many practitioners who would be watching this program and would want to know who qualifies to take a course in fascial manipulation.
They can check in our website, that is fascialmanipulation.com, and they can find the different courses that we have around the world. The last year we have organized a course in all the continent in more than 50 different countries. So I think that they can find a course also closer to their house. It's not a problem. Or they can come in Italy.
One of the most interesting things that, as you mentioned, people are being treated for internal dysfunction, and one of the things that bothers a lot of people is acid reflux. And it's not a condition that you expect a patient to go and see a manual therapist for it. Can you explain just briefly how fascial manipulation is able to help acid reflux? Whereas we know in most cases it's associated maybe with pyroli and other conditions.
If we understand the fascial anatomy, we can explain in a different manner also the acid reflux, because we have to understand that the fascia that are around the esophagus and the inferior sphincter, esophageal sphincter, are exactly the same of the fascia that are cover the diaphragm in the two sides. So if the diaphragm and the fascia of the diaphragm are too rigid, they work also in the esophageal wall, and they can maintain an opening in this wall, in the esophageal wall that is wrong, but is simply due to a mechanical stress that is working outside. Then we can also add that the fascia of the esophagus are totally embedded with the auerbach plexus, and so we have also an autonomic alternation that can maintain the inferior esophageal sphincter open. But surely, if we are able to release the diaphragmatic tension, the fascia of all this district, we work in an indirect way also in the esophagus. So for fascial manipulation, it's not a direct work, but we change the tension of the container, and in this way the internal organ can work in the proper way.
You are involved in a lot of fascial research, and what do you see as the future of medicine in as far as fascia work is involved?
But now I think that we are just at the beginning of the history, because if I think at just 10 years ago, the first Fascia Congress was in Boston at the Harvard University in Boston in 2007, and it was the first time that the people around the world meet to speak about fascia. After 10, 11 years, we are a big group, and the fascia started to have a literature. So we are growing very fast. And I'm focusing also in the molecular aspect of the fascia, because I think that this is a way to interest more the medical doctor, because I think that we can really, if we understand the pathological mechanism that can affect the fascia, for example, the hormonal level, we have demonstrated that the fascia are very sensitive to the estrogen relaxin, and they can explain some pain of a patient, of some female, and that would be a way to involve in the fascia research also the gynecologist. But we have understood that the fascia have some chemical component that can change the gliding inside the fascia. So I think that there is we are just at the beginning of a very big research that can surely involve also the medical doctor.
Is fascia involved in emotional health? You know, sometimes some patients are sent to see a psychiatrist for whatever reason, and they are fruited because maybe the doctor is not able to find the cause. So what do you think fascia has any role in emotional health?
I think that the fascia is just a missing tissue that we have to understand how to integrate in all the other practice of medicine. So it's not an alternative medicine that has to be in opposition with other elements. Also for the emotion, surely some patient can have also a fascial component. I see in my office that if you are able to release the fascial tension, the people they feel better, and consequently they are able to manage better some sensation. And in this way, for example, the psychologist or the psychiatrist can maybe work better in that patient because the body is able to answer in a better way. I know also, and I see often in my practice, that if a densification, a fascial alteration was created during a bad trauma, often until we don't care this fascial alteration maintain a memory in our body, but probably also in our brain, and these don't help the patient to pass over that trauma. We release the fascia, we care the fascia, and then the patient is able also to manage better the memory of that trauma. So, but it's just an integration.
Wow. Finally, what challenges do you face in research and training of fascia? I mean, what are some of the challenges you're facing? Challenges is like hindrances or blocks you're facing in fascia research, and at the same time training acceptance of fascia manipulation to your colleagues in medicine, and also to the manual therapists who are practicing the same, who are practicing out there.
Sorry, I have to understand.
Okay, I'll repeat again.
Thank you.
My question is, what challenges is like what difficulties are you facing when doing fascia research, and at the same time when you're trying to train people about fascia?
Okay, so we have first of all we have a problem to convince the people that fascia is important. Above all, and it's for this reason that I'm fighting to use a correct terminology, to stay in a more scientific way as possible, because only that way we can really interest the medical doctor, the traditional medicine, that fascia has an importance. But if when I hear some very strange idea about fascia, that is working a very bad way, because a medical doctor, if they feel that this part of the fascia, they say, okay, I'm not interested at all, it's a totally crazy thing. At the contrary, if I show the anatomy, I show the histology, I show the molecular medicine, they say, okay, we can speak about that, there is something that could be integrated in my concept. So that is surely a big problem. And the second problem that I have that is also the money, because it's a very bad thing. But to support this course was created just to support 1 year of research here in Padua.
Yeah.
Because there is no grant for the fascia research at all. There is grant for the diabetics, for the oncology, for many different diseases, but it is almost impossible to have a grant for fascia research.
Thank you so much for taking time to do this interview.
Thank you.
And
Thank
we
you
wish
so
you
much.
all the best in your work, and we hope that one day your work will really be recognized, and many people across the world will be helped by what you're doing. Thank you very much.
Thank you. Thank you so much.